Hi, Les Blackstock from Enhanced Clinic here again. This is another in our videos to help people understand before surgery, and we're wanting to talk about a very sensitive area, and that's when cosmetically things aren't exactly right. Now obviously when we have the surgery you can get complications and we explain these risks. We quote mostly around about 0.5 to 3.5% of surgical risks: infections, wound breakdowns, bleedings, hematomas, sensation changes. Now if these things occur, this is something we'll treat medically. We'll work with you, with your local doctors. Costs are generally as low as we can possibly make them because it's an unforeseen complication. They can occur, we'll help you. We're talking about the situation where there are no complications, where healing goes well, but there's something aesthetically that you just don't like. Now remember, in the consultation process, we've explained to you that some studies show that between 3 and 15%, so 1 in 8 people, will be unhappy cosmetically after a breast implant for aesthetic reasons. And we've also told you that there's an 8 to 10% chance, again, that's 1 in 10, 1 in 12, of you coming back and having another surgery in your lifetime. The reasons are fairly common. So the most common reason is quite simply that the breast implants have ended up not to the size you would like. Remembering, it's your muscles that limit the size if we go under, and we're one of the few places that involve you in that decision. So if you are one of those people, and 80% of women after implants wish they'd gone bigger, and around about 5 to 10% really passionately want to go bigger, you've got to anticipate there'll be some costs because there's a new implant, and we've told you how we reduce the cost. Going bigger involves risks, so you've got to balance up that if you go bigger, there's more chance of sagging, you've got all those surgical risks again. So and sometimes that desire for small changes may not be worthwhile for the rest. And this is an individual decision. In the discussions, we'll work through everything with you. The other main problem is descent. So the implants, when we finish the surgery, we have a picture of you sitting up, nipples aligned, everything good and equal and balanced. In fact, you're involved in that decision. Now, how they descend, it's when you leave the office and the surgery, the pockets are equal. Now, you have to do some work and they can come down. Sometimes they come down too low, so that's sagging. Stay too high, come down irregularly, go too far from the side or too far from the center. Or equally, they come down but the nipple doesn't move but the implant bottoms in. Now this can be on one side or both, and obviously this can cause irregularities. Now if you're one of the, and our numbers are running at 4% of people that we have, we want to help you, but you have to understand that you've got to see these as things that take a time. So if you're seeing these things in the early couple of days or weeks, please allow us to give you time to follow the instructions of rolling the massage, things that we can help to bring down. And remember, of that 4% of people, when we analyse them, 80% are smokers. So that's why we're very, very religiously enforcing now that if you smoke and you don't stop, we won't do your surgery. If you take up the smoking again after in that recovery period, so that's up to 6 months, we will not be able to help you. But if you are one of those unfortunate ones who have got problems, we'll work with you. Now, the surgery will usually involve something to come and help, that we have to go back in, help to descend, lowering or gaining a pocket. So it involves the whole surgical risks again. We have to then know if you're going to have an implant that's stretched in the pocket. The worst case scenario, we may need lifts, and that's quite a significant cost, and we've told you about these things beforehand and we've advised you what's more likely. We can't pick an individual person. That's why we tell you the story of the 20 versus the 45-year-old. There's a video on this of who will sag and not sag. Can't be picked. We will work with you though. So if you give us time, talk back, we'll discuss the options. You always have to go through another opinion so you can hear it, and we'll try our best to reduce costs. And as we said, the most common reason is wanting to go bigger, so the surgery will be less than the initial. But you have to understand, there's the theatre set costs, there's the implant costs, so we need to make sure that you realise that, and we tell you all this written information before you start. Now you do hear of things called the Snoopy dog, where the breast falls over the top if the implant can't be big enough in the bigger, heavier breasts, double bubbles or folds or creases. These things, again, we don't want them to occur, but when they do, we can work with you. They will require most of the other operations. So in all this process of this 4% of people who are aesthetically unhappy, you need to come back and work out, yes, that unhappiness, is it enough to justify the costs and the risks of the surgery, or is it something we can tolerate over time? So I would ask everyone to understand we have a system, we have designated nurses who deal with those very rare amounts where there's complications, and they can help you through the process of this ecstatic concern. We'll be talking to you constantly, and that's why we're one of the few who contact you at 2 weeks, 6 weeks, 3 months and 6 months to make sure changes are going well. So we'd please beg of you. We work very hard to get this and keep the costs down, and we do also hope you understand that if you're that small percentage and you're occupying a lot of our time with unreasonable expectations, that it takes away and adds cost that we have to transfer onto the other people. So work with us if you're one of that small people that hasn't worked out for you, and we'll get you the best outcome we can. Catch you later.